Hey everyone, welcome to Healix Heroes, the podcast where we honor the people behind the scrubs. Not just what we do, but who we are. Today's episode is about the moments that stay with us, how we cope with the weight of healthcare, and the lessons medicine teaches us along after the shift ends. Hi, I'm Toria. I'm a registered nurse. I've been in critical care for 6 years and have been an aesthetic nurse injector for 4 years. And I'm excited to introduce my best friend, Dr. Marius Alexander. Tell us who you are, your role, and how long you've been in healthcare.
My name is Marius Alexander. I practice emergency medicine. Been doing it for about 6 years now, 3 years after residency so far.
Well, thank you so much for being here today. None of us leave this work untouched, and while our roles may look different, doctor versus nurse, there are moments in patient care that stay with us. So I want to talk about those right now. Is there a patient interaction or moment early in your career that really shaped the way you practice today? Now, for example, mine was early on as a new nurse. I worked in the neuro ICU and I had a patient in critical care who switched to hospice. And one of the things that she wanted was just to be clean, just to feel fresh before she went to hospice care. I remember doing a full-on bed bath, and then I remember actually washing her hair, because in critical care you can't really wash people's hair, especially with their critical status. So I remember putting her back down, getting her the bed basin, and actually washing her hair. And the smile that she had and the actual smiles that my patients' family members had, they were super appreciative. And that moment stuck with me as a new nurse. So what moments early on really shaped you and your practice today?
Man, when I think about it, I think I had a moment where I was actually a medical student at the time, and I was taking care of this lady who was had some pretty metastatic bad lung cancer, and I was just a medical student, and I had to go in the room and ask all those questions that people are annoyed about, and she was just like, "Honey, I know what I got," and she kind of shut me down, and she was like, "Can you just get me some cake?" And I walked all the way to the cafeteria and got her some cake, and she was just happy with that. But just being able to be there for her in that moment, knowing that she had this, terrible disease, and she didn't really need my medical expertise at the time. She just wanted some cake, and I was able to get her that. And I think I felt good about that moment, and that made me know that I was in the right field, doing the right thing, doing the right thing with my life.
Nice. So what's a moment that still crosses your mind long after the shift ends?
Oh man, I mean, every day is just, did I, after I leave work, did I take care of everyone appropriately? Did I order everything that I needed to order? For example, I saw this 8-year-old girl one time, and she had, just some lymphadenopathy, just some her cervical lymph nodes were inflamed, and she probably just had a common cold. But I was like, it could be this. It could, it was going through all the differentials in my mind. And, I work at a lot of different hospitals, so I didn't really work there for some time. But the first thing I did was, when I went back to work at this facility, was call her mom to see how she was doing, and she was like, "Oh, she saw her pediatrician, she's fine, it's all down now." And I was like, all right, so I feel like it never really truly ends. At the end of the day, you're always trying to, questioning yourself, thinking did I make the right decision in these moments? And, did I order that random potassium for that patient whose potassium was 3.3, but I needed to order that potassium for them.
We all have those moments, literally.
But that's pretty much, the things that kind of stick with me long after the shift is over.
Well, how do you carry those moments, and do you talk about them or process them privately?
It really depends on what the moment is, I guess. Me and my group of ER buddies, we always talk about all our crazy cases, how we handled it in the moment, how we were feeling in the moment too. Oh man, I had to intubate this 3-year-old and my heart was racing, but obviously in the room at the moment, you're
calm.
not,
You're
calm,
yeah.
you're with it. You're not,
it's different.
you're not talking about it. You have to resemble an entity of being calmness when everyone else is around you is freaking out. So, but you can kind of relay that info because they know how you're feeling. They've been in that moment before. So, me and my ER buddies have this group chat, and we all went to residency together, so they can all relate. We're all in similar levels of training. We're all attendings now. So, I kind of, talk to them. They're kind of my outlet for my stress and when I have a difficult case and stuff like that, because they understand the most, because they're also ER doctors. And my wife, I like to come home and tell her something when I have a crazy story. She doesn't really like a lot of blood or anything like
Neither
that.
Neither does
my husband. But I leave the gory parts out and then just tell her the main parts and then kind of go from there. But,
trim the facts.
Yeah, trim the fat.
Right. Well, when you have moments like that day after day, it can start to show up in ways we don't always expect. So I want to shift the conversation to something every healthcare worker feels at some point, which is burnout, stress, and how this impacts our mental health. Burnout is talked about often. So when did you first realize stress or burnout was affecting you? And not just at work, but outside of it. Like for me, it was during COVID. I remember going into that and being so overwhelmed. I never had a patient that really lived to my next shift. It was always death, death, death. And bringing that home to my husband, at the time, my fiance, it was really, really hard. And I remember I had to like really buckle down and be like, I cannot bring my work home with me because it really does take a toll in any relationship, truly, honestly. So how did you first realize burnout was affecting you?
I mean, I started training, at the peak of COVID in 2020. And it was just, crazy at times. You go to the hospital, like you said, people dying left and right. You're trying to do your best. You're counting up. You're going into every room. And the way that I feel like burnout first started affecting me was just like extreme fatigue, like just like not wanting to get out of bed, like go to work in the morning, and then but I like to think I'm like a pretty energetic person. Like I have a lot of energy. I try to work out, 5 to 6 days a week. But I was just like, why am I so tired? It's
a mental toll.
Yeah, and knowing that sometimes you just have to take a step back, bring what you're feeling into the light, and then talk about it with whoever supports you and things like that, and try to not feel like that. Know that you're even though it looks abysmal at times during COVID and stuff like that, you're still making positive changes every day and making an impact every day. But I feel like that was like one of my first symptoms of burnout, I guess, as a young resident. Now when I start to feel that way, I know like, hey, I got to take a few days off. I got to go on a trip. I got to, do something that excites me. And, like you said earlier, not taking your work home with you, like when I'm away from the hospital, I try to leave that separate. So, and it's easy to do as an ER doctor because I work shifts. So it's not like I have patients contacting me and stuff like that. But, I try to finish all my notes on time. That way I'm like, it's like out of sight, out of mind until I go to work like the next day. So.
Right. So how do you decompress after emotionally heavy shifts?
Oh man, I like to, I have hobbies just like everybody else, play video games, watch a good show.
The Pit.
I mean, even if it's a good show, it helps me decompress. Watch a good show, play video games. I work out, I think, good exercise is just a good way to relieve stress. And I know it's kind of like, those things that, the doctors just tell me. But I really think like it does help me kind of like put my energy into something else and relieve my stress. And that's kind of how I kind of deal with it on an everyday basis.
I agree. Have you learned any boundaries that protect your mental health now?
It's kind of hard to protect yourself. I mean, especially when you have a really rough case and, it's sad. I feel like if you let yourself feel it in the moment, afterwards, we have, after a hard case, we have a little decompression session and, we all kind of go around the room and we talk about it and what could we have done differently? What could we improve on? How good of a job everyone did in the moment and stuff like that. So, you can kind of do that, I feel like, to protect your mental health in the moment, and then just kind of deal with it in the moment. That way you're not, carrying it forever or holding on to it when you leave the hospital, if that makes sense. I guess that's how I would,
That's a good boundary.
Yeah.
It's a good boundary to have. For me, it's like I just talk about it in that moment. Like I come home to my husband and I'm talking about it and I try to like say, okay, that's it. No more talking about it. I've let it go into the space and that's it. Don't bring it back up.
Yeah.
Have you or something you wish was normalized in healthcare when it comes to mental health? What's something you wish was normalized?
I mean, honestly, I feel like it wasn't so normalized before. Like, now we're talking about, depression, you're seeing, patients with anxiety, depression,
Well, physicians and nurses, like anyone in healthcare has the highest suicide rate.
Yeah,
It's crazy.
And now you're like, I hear nurses all the time talking about, I took my Lyrica today and stuff like that, which is cool. They're seeking treatment for, stuff that they're dealing with and battling with. But I think like, maybe 10, 15, 20 years ago, it's like, hey, no one talks about that stuff, like we keep that stuff tucked and tight. And, part of my job is to see patients going through these, episodes and things like that. So it's like they have somebody that they can relate with and we can have this open discussion. And I don't think, I feel like before, looking at doctors, them being depressed or, alcohol abuse, substance abuse, stuff like that, was frowned upon, Now I feel like there's so many like stories out there where like this doctor was doing this and now he kind of turned his life around, or, this doctor has been depressed and now they're, taking medications to help themselves, be able to get up every morning and go do the job that they, learn and love and things like that. But I feel like the conversation is definitely shifting. It's not like something that we look down upon anymore. It's like more like emboldening.
Right. I wish taking medications was more normalized.
Yeah,
because I feel like when you say I'm on antidepressant or I'm on anti-anxiety med, people are like, why are you on that med? I wish that was more normal for at least mental health or like healthcare workers,
Yeah, I feel like people know all the meds now. So it's like I'm taking it. I take Xanax, I take Lyrica, I take a Seroquel. So it's like, do what you got to do to help you feel good about what you're doing every day, feel good about yourself, and then, live your life, so.
Yeah. Okay. A deeper question. Do you feel healthcare culture is improving around mental health? And I know we kind of touched base on it, or do you think we still have work to do on it?
Oh, I definitely think there's still work to do. There's so many resources that, I feel like people still don't take advantage of, wellness clinics, things like that. Things in the hospital, like
programs in the hospital.
The programs in the hospital, sometimes hospitals have like inpatient psychiatry and stuff that you can also go talk to. But I definitely think overall it's improving, but I feel like there's still a lot of resources that we ourselves don't take advantage of that we should, if we're feeling a certain way, relay that to someone before it gets worse, before.
Sometimes we're the worst patients.
Exactly. Of course. Yeah,
right. We take care of other people before we take care of ourselves.
Exactly. Yeah. We always put ourselves on like the back burner.
Right.
But for our patients, they come first. But sometimes we need you can't take care of, yourself. You can't take care of anyone before you take care of yourself.
Correct. Because if you go into work and then you're not mentally like ready to, take on the day, then you're setting yourself up for failure.
Exactly.
Yeah. So one thing I noticed when I hear all this is despite the stress, the long hours, and the emotional toll, many of us are still here because this work has changed us and in meaningful ways. So it teaches things no textbook ever could. So let's talk about lessons in medicine that has taught you, not just as a provider, but as a human. So what is one lesson medicine has taught you that applies beyond work?
Patience.
Patience?
Just being patient with everyday life. I feel like everyone's always in a rush to get somewhere.
Right.
Everyone's like, cutting you off in traffic, on the highway, things like that. But if you take your time, less accidents, you'll get to where you're going, and you won't feel, when you get there, feeling rushed is never good. You gotta.
You get anxious at the end of
it. Exactly.
By the time you get to your destination, you're like, oh my God, like, I don't even want to be here.
Yeah. Take your time, get there safely, take care of yourself, and then, in things that you do, if you're not good at it right away, be patient, practice it. We call it practicing medicine because we're always practicing, right? You can't really master this because everyone's different. Everyone comes in this, we always say patients don't read the textbook. So you can't, someone's not going to come to you with the exact same symptoms all the time. You gotta,
nothing's textbook.
Be patient, be in the moment, know how to, get that information out of people and just take your time is what I would say. And I feel like that helps me in the hospital and in everyday life. So
yeah, patience is key. I think that's one good lesson medicine has taught me as well. How has healthcare changed the way you view life, your time, or your relationships?
Oh, I mean,
I value life a little bit more than a normal person would, right? They get into their car and they just do their everyday life. For me, I'm like, I get in this car, this machine could do me wrong, or someone on the highway can do me wrong. You know what I mean? So
just never taking any moments for granted. I would say, that 5-minute phone call I might have with my mom, just never taking that for granted because, in our job, in our field, people don't always get to say goodbye, and, never, ending a conversation on a bad note because you never want to feel like, oh, I could have said, that was the last thing I said to them and that was so mean, or, that was not the nicest way to say something, because that could be the last time you talk to that person. And we see a lot of those, last moments in the hospital, and, you never want to tell somebody their family member's gone and, they remember like, oh, the last thing I said to them wasn't that nice. So, just never trying to end on anything on a bad note. Just, always trying to be present, always trying to be in the moment. feel like that's
Time is a present. Like, you live in the present and
Yeah.
don't think about the future too much. Yeah.
I agree.
So no Lamborghini in 4 years.
Nah, maybe.
So what do you think?
I have goals for myself.
Oh,
I
okay.
have
So
for
goals
myself.
for your future. Okay,
Yeah.
that's okay to have. Yes. Okay, sure. So what do you think healthcare workers understand about life that others might not?
We know we see it come and go, very quickly. So I think we can show some empathy. We have empathy for people, and we throw ourselves into the fire every day, trying to do what's best for our patient. And so I think we can definitely show some more empathy, and I feel like we probably have more empathy than the rest of the normal population.
I do too, because like, I mean, anytime I drive past a homeless person, I'm like, oh my god.
Yeah.
You
even feel something.
Yeah, you do, and people will tell you like, well, what if they're just faking it? I'm like, oh, I don't know that, and so I'm gonna give them whatever dollar bills I have, no matter what they use for something else that I don't know what they're gonna use it for, but
like
I'm gonna give that dollar.
Yeah, to help people.
Right.
So it's like you always wanna, sometimes at work we get, into a mood or something, but it's like we come the next day because we have a calling to help people. This is our job, but it's also like, okay, like it's more than kind of our job. Like we have a true calling to help people and help patients and stuff like that. So
not just a profession, it's something that we love to do each and every day.
Exactly.
So if you could speak to your younger self on the first day in scrubs, what would you say? Because I know what I would say, but what would you say to yourself? Medical student or first day, like when you were doing your interns or residency?
I would just say, it's a long journey. There's a lot of ups and downs. Don't be too hard on yourself. It's gonna feel like every day is a battle, which when you're in medical school,
it's a long uphill battle.
Yep.
And then you're coasting afterwards.
And then somewhat, I guess. And then just don't be too hard on yourself. 4 years of medical school, 3 years of residency. It's a long journey, but eventually, you'll get to a point where you can do it, and you can go in there every day feeling like you're doing your best. But we practice this, so it's like every day, every day I'm watching a video, continuing to get better every day.
Right. I don't know if you remember, I think we both shared this experience. One of our advisors told us that we would never be a doctor, never be a nurse. Yeah. And I remember, thinking back to myself and my scrubs, I'm like, oh my God, here I am. Yeah. I'm a new nurse. Like, beat that, advisor.
I mean, I think about stuff like that all the time, just think, perseverance and stuff like that. And, never letting anybody tell you can't do something.
Right, because we can.
Yeah, because
here we are.
No one can put a limit on you but yourself. So I feel like, that's what I would tell my younger self, just to, give him the energy to keep going.
Yeah, don't listen to anybody else, do you, and succeed.
Yep.
Keep going. All right. Before we wrap things up, let's lighten things up and have some rapid fire fun questions. No overthinking, all right? Just whatever comes to mind first.
Okay.
You ready?
Yep.
All right. Coffee or energy drink?
Energy drink.
Day shift or night shift?
Night shift.
Your favorite scrub color?
Black.
One thing you must do after a long shift?
Shower.
Right, you never know what comes out from the ED.
Definitely,
you guys see a lot more gross stuff in the ICU.
Definitely shower.
Yeah, I mean, we have some C. diff in ICU, but I mean, we're gowned up. All right, charting, love it or tolerate it?
Tolerate it.
Okay, worst shift snack you've survived on? Graham crackers for me.
Graham crackers, peanut butter.
Applesauce.
Whatever's in the fridge.
The popsicles are not that bad.
Popsicles are pretty good.
The sugar-free ones are not that bad. One song that gets you through a tough shift?
Oh, man. Probably something by Drake. I don't know.
You just love Drake too much. Okay, if you were in healthcare, what would you be doing right now? I'd be a ballerina.
Man, I want to do something cool, like an engineer, an architect.
You would do something smart. You would continue being a smart person. Like me, I want nothing to do with my brain. I want to be dancing and living best life.
Yeah, something like that I think would suit me well. More relaxed environment. Yeah.
Got it. Okay. So, scrubs at home, yes or absolutely not?
No.
Absolutely not. You never know what you're bringing home. Okay. Words patients say that instantly melt your heart.
Thank you for taking care of me.
Thank you. That's a good one. Like, I really do appreciate when they say thank you. Even after a long day, and like, let's say you have one rowdy patient and I go to my next room, they're like, thank you for bringing me a cup of water.
Another one is kind of off topic, but when I see another like, African American patient in the hospital, and they're like,
Oh my God.
they relate to me, or they tell me
Yes.
something like, proud of you or something like that. That one always gets me.
That one's with Spanish speaking, because there's not a lot of
Yeah.
nurses that speak Spanish. So when I go into a room and they're like, oh, they speak Spanish, and I introduce myself, hola, me llamo Toria, soy enfermera, and they're like eyes light up. They're like, thank you for talking to me in Spanish, and like they're just so appreciative.
Just a comfortable level
Yeah.
that they feel that, and I know, like, okay, like I'm supposed to be doing this.
Yeah, exactly. It feels great inside. It does. Okay. So, like I said, before we wrap things up, I want to say thank you for coming on, not just for what you do, but for who you are in this space. These stories matter and they deserve to be honored. And so at Healix, we believe scrubs are more than just a uniform. They're emotional PPE, and they hold our long days, our hard moments, and our wins that we don't always want to talk about. And it's a small thank you. We want to gift you scrubs from Healix to honor the work that you do and the human being behind them. All right?
Oh, thank you so much.
So, maybe they're black, I don't know.
Whoa.
I asked for pink. And what does being a Healix hero mean to you?
Oh man, I mean, just trying to do my best every day and represent the our healthcare community well, and try to take care of my patients as best as possible.
Find the cure for cancer?
One step at a time,
Yeah. Well, thanks for listening to Healix Heroes. If this episode resonated with you, share it with someone who lives the life behind the scrubs, and because their stories deserve to be heard. So, bye guys.
Thank you.
Thank you.